Hey everybody, Cody Barnett, Bodyworks Physical Therapy and Concussion Center, and today I wanted to talk to you about what type of exercise is not only okay to do when you're having back pain, but also what exercise is typically beneficial to do. And one of the questions that we commonly get asked, like almost every day, is my back is hurting, can I go back to exercise or can I exercise? And the short answer is for most people, yes, absolutely. And in fact, there's very, very good evidence, very good research that shows that just strict bed rest is actually detrimental. So we want to get people moving as much as we can in terms of when they're having a back pain episode. So 3 types of exercise that you can do and actually should be beneficial for you to do when you're having back pain. Number 1 is if you have access to a swimming pool. A swimming pool is a great way to be doing a little bit of movement and getting some stuff going when you're having an episode of pain. Typically, if we're in water up to about mid-chest, then we're only weight bearing about 20%. It's kind of like being on the moon, walking on the moon, 20% weight bearing. And so if you're doing some just basic exercise and movements in the pool, can be a really beneficial way to get stuff going and loosen up without creating pain. So doing things like just walking in the pool, walking back and forth, walking side to side, using a float and doing some gentle cycling movements in some water can be really, really beneficial when you're having problems. Number 2 is if you have access to a bicycle. I really recommend a recumbent bicycle, because with a recumbent bike, this is a version of this, you may not have something quite this fancy at home, but if you have a bike that has a backrest that you can recline just a little bit and then do your cycling this way, that can be a much more easier type of movement for our lower back without creating problems. And so if you either have a recumbent bike or you're able to go to the gym and use one there, that would be a great option for you, provided it feels good and comfortable for you. And then the last thing may sound brutally simple, but number 3 is going for a walk. Okay, and then just going for brief walks throughout the day, maybe a couple of times a day if you're having an episode of pain, even 10 minutes up and down the street, walk around the block sort of a thing, can be really helpful as far as getting stuff moving. It makes our hips move, it makes our pelvis move, it makes our lower back move, and just those simple things can be really, really beneficial when you're having problems. Of course, if any of these should aggravate you, feel free to reach out to us and let us know. But generally speaking, for most people, these are 3 things that can be really not only good to do while we're exercising, but really actually help speed the process. So if you have any questions about this, as always, feel free to reach out to us through our website, through our phone number. We still like to talk to people on the phone, bodyworksphysicaltherapy.net, or feel free to call us at 316-558-8808. And as always, we like to keep people mobile, active, and off pain pills. And so if you need any help with that, please feel free to reach out. Until next time, we'll talk to you later.